Tattoo artists literally bend over backwards to give their clients an artistic masterpiece that they will have forever. Tara Fenn, owner and tattoo artist at Body Designs in Deer Park, has been tattooing for 14 years, and her clients aren't the only ones seeing a change to their body.
I would say that the discomfort in my neck, my back, my shoulders, my hands, forearms, things like that, probably started within the first few years of tattooing because of the wear and tear.
She has the x-rays to prove it.
So this is a picture of Tara's neck. And if you can see here, there's a yellow line. That's like the curve in the neck that we normally would see. And Tara's neck has reversed into the wrong position. So it's putting a tremendous amount of pressure on the discs in between, the nerves that come out of these openings here, and also the spinal cord, which runs from this area through the back part or the middle part of the neck here.
When I started seeing the chiropractor, he had done a bunch of x-rays for me to just get a handle on how things, are with my neck and my back. And one of the things that he pointed out to me is that I really don't have the curvature in my neck anymore that most people do as far as the spine goes. I believe, and he believes, that a good portion of that is contributed by what I do for a living, having my head down, being hunched over, things like that.
So if the spinal cord was like this rubber band and it was thick like this, in a normal curve, it would look like that. But when there's a reversal, what it's doing to the spinal cord is it's stretching it. So when you have a stretching on the spinal cord, energy from the brain is going to have a more difficult time getting through that spinal cord because of the tension and because of how thin it is. So what that can lead to is an array of different health issues. One is could be neck pain, headaches. Those are the most common things that people see us for when they have this kind of a condition. But because it's also putting pressure on that spinal cord, it can then affect the organs, the glands, and the rest of the system. So it decreases the body's performance or the body's health potential.
Tattoo artists are at an increased risk for musculoskeletal disorders, which range from carpal tunnel syndrome to tendinitis. These symptoms get worse with repetitive work tasks and the unnatural postures necessary to ink someone effectively, according to a recent study from Ohio State University. In the study, 10 of the tattoo artists went over the recommended muscle activity limit for avoiding injury in the upper regions of the body.
I usually prefer to try to do shorter sittings for people, so that way it's less time for me to be hunched over and in uncomfortable positions, but there are times that I can be tattooing for as long as, 4 or 5 or more hours at a time.
This tiger took 7 sessions to finish, 1 to 2 hours per session. On average, Fenn spends 20 to 30 hours tattooing per week. It's no surprise that on top of visiting the chiropractor once a week, she also goes for weekly acupuncture treatments and visits her massage therapist once a month.
I get a lot of tension headaches because of all the tightness up in here, also a little bit on my hands and the forearms because they take a lot of the grunt of the work as well.
Muscles tend to get constricted if you use them over and over again, and so massage will help release those tensions and pull the muscles and stretch them out so that they're not constricted anymore.
With regards to Tara's issues, what happens is we go with what they call a channel system. And channels basically go up and down our bodies, kind of like a highway system. So think of the Saginaw Coast Parkway and the Southern State Parkway. If the Saginaw Coast Parkway is backed up with traffic, there could be an accident on the Southern State Parkway in Nassau County. We don't know. So based on the ideas and principles of acupuncture, we find that with regards to her, there's a lot of issues with the urinary bladder channel, and so the treatment actually works to help to unblock those blockages that are so far away that are actually causing the pain or the manifestation of the real root of the problem. How are we feeling? How's the neck doing?
Deanna and Monito say Fenn's love of tattooing is slowly wreaking havoc on her body.
Well, as a tattoo artist, her neck tends to be extremely tight from leaning over. She gets a tremendous amount of tension headaches, so we work the neck area into the traps and the shoulders. Her hands tend to be constricted all the time, so that creates tension in your forearms on the front side and the back side, so we work those areas.
Tara's a little different because the mechanism of injury is her work, you can tell, I mean, she loves what she does and she does a lot, right? So she's going to be over in that position, hunched over and trying to get into awkward positions to get a person to actually have this beautiful artwork placed on their body. And you know it's going to be an issue all the time.
Knowing all of this, Fen says she won't let these conditions keep her from her passion. Luckily, Hansen says with weekly visits and some homework, Fen can start to reshape the curvature of her neck.
So when we're adjusting her, we're putting motion into these segments to unlock the area. And then we also do a traction technique with a tool called a Deneroll to help with putting the curve back into the neck. And that takes the pressure off the spinal cord, the discs, and the nerves so that the brain can communicate with the body the way it's supposed to. So it keeps her healthy and keeps her alive and keeps her functioning at a high level.
For Push Pause in Deer Park, this is Valerie Gordon.